Hey Rand, it's Dr. Valinga, Peter, and the rest of the team. You are asleep. We examined your knee while you were asleep, and it was stable. All the ligaments were nice and stable, which is good. We've inserted the camera into your left knee. What you're looking at is a cannula here with a probe coming through that. This probe is 1 millimeter wide and 3 millimeters long at the tip there. Gives you an idea of the magnification. We're looking up above here. What you're seeing is this white structure up here. I'm pushing on your skin from the outside. That's your quad tendon. Looks very normal. As we back up here, that structure you're seeing right there is your kneecap or your patella. You've got a little bit of fluffy tissue there. And you can see the cartilage. We want it to be smooth like up on there, but you can see this lower part. Hard to see it perfectly, but you definitely have some early arthritis and some loose flaps of tissue, which that's what we were kind of expecting to find. So we'll get that cleaned up for you here. See all this loose kind of tissue floating around right here. Try to sweep some of that out of the way there. All right, so up here, get a little bit of wearing on the undersurface of your kneecap there. As I look over here, you got a little plica band, not too bad. I'm going to swing over to that inside of your knee there. No loose bodies, that's normal in appearance. Sometimes in what we call the gutters, we see some loose bodies, but I think this is the biggest issue in your knee right here. It's hard to see with all the loose stuff in there. I have to get a better picture of that once I clean up some of that fluffiness. But you've got some arthritis building in your knee there, which is not the best of news. So we'll see the extent of that in a second. So here we are on the outside of your knee here. There we go. Look down in here. Looking for any loose pieces floating around, nothing crazy. That's your popliteus tendon, which is normal in appearance coming up out of that hole. As we back up here, we do see the front part of your lateral meniscus, which looks fine. There's your ACL right there, which looks fine. PCL is right behind it, actually right there. Looks normal. We pop over here. We see the front of your meniscus there, but more importantly, we start to see that. Look at that cartilage on the end of your knee right there. So this is more significant arthritis wear than we would hope to find. You can see these big flaps of tissue right there. We know that as your knee bends and rubs on this bone, you can imagine how this big flap is catching and causing that kind of locking, catching, popping sensation in your knee. So, not super excited to see that. It's sad to see that because we know that wearing out of your knee only kind of goes one way. Here in the back of your knee, little tiny loose pieces back up in there. We'll get those out. As we look back here, back of your meniscus there looks fine. PCL, which is right to my right. This white structure coming up there looks fine. Back of your meniscus in there. That looks okay right there. I'm going to pop over laterally to the outside of your knee real quick. So I don't think there's anything here. Change the position of the leg right here. Pop up on top there. Good. So there's your outer meniscus, your lateral meniscus. That looks beautiful. We can see the cartilage, though, underneath it. Starting to get some arthritis in there. And there's actually some, this is nearly down to bone there. So, meniscus itself looks okay. No tears. There's your popliteus tendon back there. So yeah, meniscus looks good. But your cartilage on your knee right there, that's grade 3. You almost got exposed bone in some spots back there. So that's a little bit worse than we anticipated. Let's see the shaver. We'll just try to dust that up. So we're going to bring in this little shaving tool right there. What we'll do is Try to use this to just kind of dust up that cartilage just a little bit here. So it just kind of sucks in tissue. And for this, we're just kind of trying to mow the lawn a little bit. Just trying to get any loose flaps. We don't want to take off any more than we have to. Just getting the loose pieces. So those tiny little wisps, just try to suck some of them in there. Good. So I'll take this out. We'll slowly reposition your knee. Looks like, see how the cartilage on your thigh bone side is perfectly smooth? That's what healthy cartilage looks like. When it starts to get all ragged like that, that's arthritis setting in. So you have a little bit on the outside of your knee, not terrible, but we certainly have it worse over here. So let's see that shaver now. First, we're going to get some of this little fluffy tissue out of our face here so we can see better. And we'll try to start to dust that little flap of cartilage off there. So again, we're only going to take off the minimum amount here to help reduce your symptoms of that catching sensation. But some of the pain associated with this is just by virtue of the cartilage, overall cartilage breakdown from the arthritis there. Just want to get the loose pieces off without exposing the bone underneath it. So that's a lot better. That's still kind of soft, but go too crazy, we're going to make it worse. So I think that looks better. We kind of got that loose edge of the flap of tissue down. That seems more stable. Take this out. Change the position of your knee just a little bit here, and we'll look at that meniscus probe. This probe to come in here, maybe. Take that cannula off. All right, there's our probe. So we're looking closely at that meniscus again. We didn't really see anything on MRI. Top part looks okay. Bottom part looks okay too. Look over here, look under it, that looks okay. So the meniscus actually looks totally fine. No tears in the meniscus. I can hook onto it and pull. It's very stable, beautiful looking. So really, I think the main issue was this area of cartilage wear there, and we've kind of stabilized that back. Don't have bone-on-bone arthritis, but certainly have some areas of significant wear. Now we're going to look farther up that bone, because look right here. Here's where it gets a bit rough too. So turn that over there. So you can see that area of wear comes all the way up the front there. So let's see this. We'll start to clean this up here. Just kind of get rid of some of this extra tissue in the front there. Now we'll try to just get some of these loose pieces right in here. You can see you had quite a few loose flaps of tissue. So I want to get all those loose pieces out of there. A little bit of a flap there. Good. We're talking just taking millimeter here, millimeter there. Good. Any of these. So you can see this whole portion is really almost down to bone. This is grade 3. We call grade 3 change. There's 4 grades. Grade 4 is when you have straight up exposed bone. Grade 3 is when you've got kind of looks like this crab meat, but not exposed bone yet. Let's see a probe. So this is the part, the problem is where you have the worst wear from here all the way up to there. This is the part that when you're walking, this is where all your weight is going through. So your knee's bent right now, but you can see as I straighten your knee there, now your knee's straight. So when you put your weight through it, that's the part of your knee that this is going through, that area of wear right there. So it's a pretty tough problem to have. I do think by doing this, we're going to decrease some of the symptoms you're having. Let's see the shaver. In terms of the pain associated with the locking and catching of your knee, unfortunately, I do think that some of the symptoms of just the overall kind of aches and pains of it, that's the arthritis talking. And there's not much to do there. So I don't see a ton of loose pieces sitting in this area in here. Just make sure. Mow that grass briefly. Good. So as we talked about, there's no arthritis. Your kneecap looks really good. Little area of wear up in there. Let's turn our eyes here. You can see those loose pieces of cartilage right there as well. Just make sure there's no big loose pieces, and there's not there. That's just another area of wear on your kneecap in that one spot there. But you can see as I bend your knee here, how that rubs, right? Rough spot on rough spot there. And that's why you get discomfort in the front of your knee, certainly on the inside of your knee as well. So that kind of completes what we got to do here. Let's see that blue cannula. We'll go ahead and get the rest of the fluid out, any little extra pieces. With our cannula, we can suck out the rest of these little pieces here. So no big surprises, loose flaps of cartilage like we thought. I think the arthritis is a little worse than we thought. But we'll see how you do. Some people can go for quite a while with this. But for you, if you don't, after recovering, getting your motion and strength back, if it's still really bothersome after multiple months of recovery, you know, we may be starting to look more of, you know, different arthritis treatments for you. So anyway, we appreciate your trust. Glad we were able to take care of everything. We hope this makes a difference for you and really helps you out. And I'll talk to you in recovery. Good luck.